Hi everyone, my name is Trevor Gordon. I work with the Canadian Epilepsy Alliance. I do the communications with the Canadian Epilepsy Alliance. Today we have a special guest with the International Bureau of Epilepsy, the IBE. But before I bring on my guest, I want to talk a little bit about what the Canadian Epilepsy Alliance is. The Canadian Epilepsy Alliance is a Canada-wide network of grassroots organizations dedicated to the promotion of independence and quality of life for people with epilepsy and their families through support services, information, advocacy, and public awareness. As the voting member of the International Bureau of Epilepsy, the IBE, the CEA is the voice of those living with epilepsy in Canada and internationally. The IBE is the international organization that serves to develop support and link national epilepsy organizations around the world and exists to improve the quality of life of all people with epilepsy and their families and careers. The Canadian Epilepsy Alliance works with the IBE and participates in global initiatives representing those living with epilepsy in Canada. Today we are going to be chatting with the CEO of the IBE, Donna, and I want to just brag a little bit about Donna before we bring her on. Donna is the CEO with the IBE since 2022. Her background is in journalism. She spent her whole career working in nonprofit organizations serving people living with neurological disorders. Directly prior to joining the IBE, she was the executive director for the European Federation of Neurological Associations, where she was a board member of the European Brain Council. Since joining the IBE, she's been actively involved in shaping and implementing a strategic direction with a focus on bringing lived experience to the center of the organization. She's excited about obviously a lot of the flagship projects and initiatives that they're rolling out. So that's exactly why we're here to talk to her, because she is a part of a lot of things. So let's good morning.
Good morning.
I always say good morning, assuming we're all in the same time zone. So I apologize. It's 8:05 a.m. Eastern Standard Time, but you're in Ireland, yes?
I'm in Ireland and it's 5 minutes past 1, so it's early afternoon for us here.
So good afternoon to you. I appreciate you doing this. I know you're a very, very busy individual, so I really appreciate you doing this. You have a bio, that's for sure. I apologize for stuttering a bit, but you have a lot of accomplishments.
Thank you so much, Trevor. Yeah, I think you're being very, very kind, but yeah, obviously I have a background in the neurological patient advocacy space, but this is my first role at a global level. So I have worked nationally in Ireland, I've worked at a European level, but this is my first time really playing a leadership role in a global organization and getting to see that bigger picture and the disparities, but also the similarities that we see across the world. And we've got more in common than we think.
So today we're going to be talking about this current flagship initiative, the Global Epilepsy Needs Study. But before we get in there, I want to kind of get to know you a little bit, just because you're the CEO of the IBE, which is like a really, really established role for sure. Like, did you know about epilepsy or have a connection to epilepsy prior to this role? Like, what was sort of your knowing of epilepsy, maybe in your childhood or growing up prior to this role?
Yeah, so actually, Trevor, very little. So as you said when you were reading my bio, I have worked in the neurology patient advocacy space. So it was really through my professional roles that I encountered epilepsy. And my previous role, I served 10 years as executive director at the European Federation of Neurological Associations. So we worked across stroke, multiple sclerosis, Parkinson's disease, epilepsy, and many other rare and complex neurological disorders. And it was, I suppose, there that I first really learned about epilepsy and the impact that epilepsy can have on those affected. But what's funny in that since I took on the role at the IBE, I've actually realized I know more people with epilepsy than I thought, because there are a lot of people who I've known for a very, very long time, including in quite senior patient advocacy positions for other disease areas, that have since come to me and said, by the way, do you know I also have epilepsy? Or by the way, do you know that my son has epilepsy, or I have a daughter with epilepsy? And so it's not something that, I had encountered. But when you start to work in the field and people know you're working in the field, you realize actually it's more common than you thought. And people open up to you and tell you a little bit about their experience with epilepsy in a way that they might not have had I not been in this role. So that's been an interesting experience for me.
I've been in the epilepsy community, I would say 8 years. And I mean, myself, prior to getting the role, I think in childhood, I think one of our classmates had a seizure or two, but it wasn't until, and I might have saw it in movies, but it was not, it was always that stereotype thing of someone just shaking on the floor, which obviously, as we all know, that's maybe one form of seizure, but not all the seizures. But for me, I didn't know necessarily a lot about epilepsy or seizures prior to my role. But I guess I'm curious to have you comment on why do you think that is, like with like awareness, like because we both know it might be a hidden disease, but by no means is it a rare disease. In your role now and being in the community, why do you think that epilepsy isn't spoken about as much as it should be?
Yeah, so obviously, I mean, I guess the typical answer to give is that there is huge stigma still surrounding epilepsy, and not just in lower and middle income settings where there's obviously major myths and misconceptions that need to be eradicated. But even, in our part of the world, you're in Canada, I'm in Ireland, high income countries, there is still this sense, I think, amongst the community that if you disclose you have epilepsy, it may impact on your chances of being employed. It may impact on your chances of having a regular schooling. We hear so often of children who've been excluded from extracurricular activities or summer camps because they have epilepsy, when children with other disabilities are accepted readily. And I think for me, what you see on a regular basis is people don't want to disclose unless they have to, because they're worried that actually somebody knowing they have epilepsy may impact on their chances in whatever field or in whatever area of life that they're most concerned about.
Yeah.
So I think we still have a piece of work to do to really ensure that we raise awareness of epilepsy, that people know what epilepsy is and what epilepsy isn't. And I think we also have to try to encourage people with epilepsy to speak out, because we know that 70% of people with epilepsy can get their seizures under control with the modern treatments we have available. And for those people, I mean, they probably want to forget they have epilepsy. I have a colleague whose brother has epilepsy and he doesn't want to talk about it. So I think in that sense, we maybe have things to do at a general public level to raise awareness, but also things to do within the community itself to really empower people to feel confident and comfortable in speaking out.
What is one myth that frustrates you that you hear all the time about epilepsy or even the community of it, whether it be in your role or just because you hear it all the time? What's one myth that if you could say it right now that it would solve it and never be said again, what myth would that be?
So I think it depends on what part of the world you're in. So if, in some of our regions, particularly in lower income settings, there is a sense that epilepsy sometimes is contagious. Epilepsy potentially, is demonic possession and, is associated with witchcraft. And, that's one side of the coin. I think on the other side of the coin, there's sometimes this perception that people with epilepsy can't do certain things because they're going to have seizures. How can they possibly hold down a job? How can they possibly engage in the community in the same way as somebody without epilepsy? And that's not true, because as we've just said, lots of people with epilepsy have their seizures under control. And, those people can do most of the things that the rest of us can do. And even for those who have seizures on a regular basis, there are plenty of things that they can be supported to do. And I think we as a community have to make it clear that people with epilepsy, are no different to people with any other type of neurological condition, or, those of us without a neurological condition. And there are ways and means in which we can really ensure that integration and inclusion in society happens.
For those that are just joining us, we are speaking with Donna. She's the CEO of the International Bureau for Epilepsy. Earlier during my intro, I was explaining that the Canadian Epilepsy Alliance is a Canada-wide network, and we are the voting member of the International Bureau of Epilepsy. Could you briefly introduce us to those that might be new to our live and learning the CEA and the IBE? Tell us what the actual International Bureau for Epilepsy is.
So IBE's been around a long time. We are over 60 years old at this point in our existence, and we are a global organization, and we have member organizations that we call chapters, 160 of them in 100 countries around the world. So it's a large global network of organizations that work with and for people with epilepsy. We partner very closely with the International League Against Epilepsy, but their focus is really on educating the healthcare professionals and the researchers, whereas our focus is very much around understanding and supporting our chapters to address the needs of people with epilepsy and those who care for them. So our vision as an organization is what we call a transformational social change for people with epilepsy, which sounds more complicated than it is. It's really around ensuring the best possible quality of life for people with epilepsy. Now, we as a global organization don't provide services, support directly to people with epilepsy. That's the job of our chapters. Our job is really around advocating to make epilepsy a global public health priority, trying to do more, as you said in the introduction, to empower and amplify the voice of people with epilepsy at all levels, and with various stakeholders, whether that's policymakers, whether that's in research and innovation, whether that's in healthcare planning and delivery. We need to ensure that what matters most to people with epilepsy is driving all of those processes. And then, of course, trying to serve and support our chapters as best we can. And as a global organization, that really differs in terms of well-established, well-resourced organizations to very small volunteer-led organizations in maybe low-resource settings. So a lot of what we do is around connecting, exchanging best practice, offering peer-to-peer support, and trying to facilitate that creation of a community to really push epilepsy forward on the global agenda.
In your words, because I mean I read it what's in the bio, but what would you say in a 30-second spiel would be the relationship between the IBE and the CEA for those that are still learning the partnership?
Yeah, so a lot of what we try to do, because we're a global organization, is work with our chapters like CEA to understand the needs of people with epilepsy and those who care for them on the ground. So when we have that type of relationship, we are well informed of what the challenges for the community you serve are. And the work that we do in terms of advocacy and awareness raising at the global level can also be leveraged by groups like yours to really push for tangible sort of changes for people with epilepsy on the ground. So a good example of this is back in 2022, IBE was really active in pushing the World Health Organization to create what's called IGAP. It's the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. And it actually calls on governments around the world to strengthen the public health approach to epilepsy. And that's a really powerful framework that we now have unanimously adopted by all member states of the World Health Assembly, including Canada. And so IBE can work at that level to put these frameworks in place. What we can't do is implement them on the ground. So we need to work with groups like yours to really push for that to be implemented, and I suppose adapted to the situation in Canada, which might be very different to the situation in the US or in Mexico or in Chile. So I think for us, it is really ensuring we understand what's happening on the ground and you can benefit from what we're doing at that more global level.
This was just a bonus question that came in my mind as you were speaking, but the one thing, and I don't know if that's my sort of OCD or being a little anal with like wording, but the one thing I really appreciate about the IBE or the ILAE is trying to get everyone on the same page about terminology and wording. And because I myself don't have epilepsy, but if the doctor or neurologist told me I have epilepsy and then I started Googling things to see a million different definitions about what epilepsy is, or is it a disease versus a condition, or grand mal versus tonic or clonic, and like for me, when I'm making sure that the websites are all correct in our epilepsy community, one thing I would love to state at IBE and ILE is just trying to come up with ways that we can try to get it all the same across the world. Like epilepsy sees no borders. The wording shouldn't be different. So I'm wondering, I just went on a rant there, but do you have any comments about that? Does that frustrate you at all?
Yeah.
And seeing that everyone seems to have different terminology and different wording, I think that would just create a lot of confusion for someone that just...
Very difficult. It's very difficult. I mean, the ILAE does really great work in sort of the classification of epilepsy as a disease, and in really sort of mapping out the sort of medical terminology. I think on our side, actually, you've touched on a hot topic, because we did a small survey with our community council, which is a group of people with or affected by epilepsy from across the world, on the terminology actually, and what they feel is appropriate and what they feel is not, with the aim of moving into next year and creating a lexicon that is going alongside some of the new branding we're developing at IBE. Because we want to ensure that the wording we use, even if it's not completely the same as the medical terminology, are words that the community are comfortable with and words that the community feel we should be using as IBE. Now, what's interesting about that, Trevor, is that there's always a difference of opinion. So no matter what word we pick, someone somewhere is not going to like it, and vice versa. So we are still kind of working internally on really understanding what that terminology could and should be for ourselves, I think, first and foremost, and also then maybe extending that out to other partners, like, for example, the pharmaceutical industry or policymakers and decision makers, so that they are using inclusive language that really reflects and speaks to the lived experience of epilepsy. But it does vary culturally across the world in terms of what's appropriate and what isn't. And there's always this big debate as, is epilepsy a disease? Is it a condition? Is it a disorder? Is it a disability? And in some ways, I think that's never going to be solved at a global level. But it is something, if we can create a narrative as to why certain words are appropriate or why they might not be, or in what context, then I think we can have that discussion. So work is happening, but it's not an easy fix.
I think this clip right here, I'm going to literally trim it, and I want this to go on every epilepsy website ever and put it on when people do a Google search, that clip just really hit the nail on the head, and I appreciate you sharing your feedback on that. So can you tell us about your current flagship initiative? We're here to talk about the Global Epilepsy Needs Study. I know the IBE has really been working hard on this, so I would love for you to talk to us about this initiative.
Yeah. So the Global Epilepsy Needs Study is kind of addressing all the things we've been talking about up until this point. So when I started in IBE back in 2022, we had this vision of a transformational social change for people with epilepsy. And when I started to ask people, what does a transformational social change actually mean? Nobody really had the answer. People had their own opinion, but nobody said, this is what it is. So we looked at the literature to see, what has been published around what matters most to people with epilepsy. And what we saw was a lot of publications focused on seizure burden, seizure frequency, seizure duration. A lot of publication on how new anti-seizure meds can reduce the number of seizures, what sort of side effects, what kind of comorbidities, a lot of medical knowledge. But what we couldn't find was any sort of international or global study that had actually asked people with epilepsy what mattered most to them, from the medical side, but also from the non-medical side of things. There were small studies from different countries. Some of our chapters had done good work in that space. but nothing on a kind of a large scale. So this is why we decided we would go down the route of the Global Epilepsy Needs Study. We decided we would look at 10 different domains of life, focusing on what we call the priority, unmet, but everyday needs of people with epilepsy. And yes, we do ask some questions around, seizure and comorbidities and so on. But in the main, the questions we're asking, or the statements that we're sharing with people and asking them to rank how important they are to them, are focused on things like education, employment, mental health, driving and transportation, sexual and reproductive health, general quality of life. And the idea is that we will start to see on a global level which of these statements are ranking most highly. So what is coming out as the really key areas that need to be addressed to improve the quality of life of people with epilepsy, and what's not so important to people, because as IBE and our chapters, there's no point in us focusing our limited resources on addressing things that people are not all that concerned about. And what we will have is a global picture, but we will also have 15 focus countries where we put a spotlight on these countries and look at the issues there. And Canada, of course, is one of those countries. So it's a survey. It's a 30-minute survey, which we know is long, but we want it to be comprehensive. We want to capture as much data as we can up front. But we will supplement that by doing interviews with people with epilepsy and caregivers in those 15 focus countries. And we will also supplement it with focus groups as we move on this year and into next year that will look at specific subpopulations that are maybe emerging as areas of concern or areas where we need to get more information. What groups they will be, we don't know for sure yet, but we're thinking about women with epilepsy. We're looking at the rare and complex epilepsies, caregivers and the needs of caregivers in this space. But ultimately, we hope to get to early next year where we have a big picture that says these are the needs of people with epilepsy globally, and that will guide our work as IBE. It should guide our chapters work at the more national level, but it should also inform and influence how research is conducted, how healthcare is delivered, how policies are developed to really support the needs of people with epilepsy according to them, not according to their doctors or other people, but according to them themselves.
You touched on Canada, where I happen to live, is housed, one of the countries involved. How is specifically Canada and the Canadian Epilepsy Alliance involved in this? Like, what would you're speaking to obviously the world, but if you're taking a moment to speak to Canada directly right now, what would you say how Canada and Canadian Epilepsy Alliance is involved specifically in this survey?
Yeah, so we picked 15 focus countries from different regions of the world, and we wanted to have a representative sample of countries in high income areas, countries in low and middle income settings, countries that maybe are predominantly the population lives in urban areas, countries where there are big rural populations, and trying to mix up the demographics so we had a representative sample of the world. So Canada is one of our countries, obviously in North America. And what we are asking those focus countries to do is to ensure we get 250 responses to the survey. The reason we need 250 responses is to ensure it's scientifically valid, because we want to capture this data and to pool it and put it in a scientific publication. So we need to ensure that across those 15 countries, we have a data set that can be compared. And our expert advisory board felt 250 responses would allow us to do that. So that's the first thing. We need lots of people with epilepsy or their caregivers in Canada to complete the survey and to share their perspectives with us. That will allow us to profile Canada as a focus country in that scientific publication, but also in a policy advocacy report that we plan to launch at the World Health Assembly next year. The other thing we can do with that data is actually give it back to the Canadian Epilepsy Alliance. So even if you guys got 500 responses, we would take a sample of 250, but that data, that anonymized data, would be given back to the Canadian Epilepsy Alliance, and you could analyze that and to see, in the different domains, what was coming out as key priorities for your community, and really understand and inform the work that you're doing at a more local level. So whilst it will inform the global picture, it's also data that can be used nationally, and people should be able to see that data in action, informing the work that is happening in Canada, but also around the world.
You kind of answered my next question about that. So basically, if you end up getting, of course, 250, we want to get at least 250, but if we happen to get hopefully more, that extra survey won't go to waste, for lack of better words. It can be used, whether it be locally or even potentially it could be used internationally. So basically, you're not turning away the other people that happen to do it above the 250 mark. You're just gonna hopefully have a pool to work with to do like a okay. That was
Yeah,
it.
exactly.
So why, I know, again, I apologize, I'm sort of asking similar questions, but it's just to kind of get sort of to the point answers at times, but why should people take this survey? I mean, as you know, I mean, there's a lot of surveys that are happening sometimes at the same time, especially during the COVID. It seemed like there was so many surveys. And by the way, these are all important, great surveys, but sometimes when there's so many surveys coming out at once, it kind of people get overwhelmed. But why? I know the answer, but why, if someone is looking at this survey, why should they do this survey? What's important about this survey?
So I think what's important for this survey is the fact that this is really the first time something like this has been done at a global level. So it is a first attempt to really sort of take the temperature of the community and to understand what matters. I think as IBE, as I mentioned earlier, we are well placed globally to be able to influence policy, to be able to use our status, and we have non-state actor status at the World Health Organization to really push for meaningful change for people with epilepsy around the world. So I think what I believe is that we will be able to take this information and we will be able to use it in a positive way to deliver positive change, not just actually for people with epilepsy in Canada, but for people with epilepsy around the world. So this is an opportunity for people to actually have their voice heard in a global study, which is the first of its kind, that we do hope will really sort of make a change for people with epilepsy. And that sense of community, that sense of a global network, I think is really important. And we have seen huge levels of responses from other countries in other regions. And I think it's really important for us that that North American region of the world is also included. I think sometimes we feel the need lies elsewhere, and we do know that, you know, a lot of the need is in lower middle income settings, but there are still major needs for people with epilepsy in countries like Canada, and doing this piece of work allows us to articulate that in an evidence-based way rather than in an anecdotal way, which is often, I suppose, how we do our advocacy.
So if you were talking to someone right now that has epilepsy or is a caregiver of someone living with epilepsy, why they should do this survey, why they should spend 30 minutes to do this survey, you know, what would you say is why they should do it, and what will they hear from you or the IBE in the future about that 30 minutes that they spent?
For sure. So the scientific publication, as I mentioned, will be ready before the end of the year. We'll be submitting it to a journal in the new year, and then we're hoping that it will be published. We're also going to ensure that that publication doesn't sit behind a paywall. This is often the issue with scientific journals. You have to pay to access the content. We're going to ensure that doesn't happen. So this publication will be freely available, and we want to also be able to house it and link to it from our website and from our social media channels so people can read it and see what the overall results will be. As I mentioned, we will also do a policy advocacy report with recommendations for action that will be presented around the time of the World Health Assembly in May next year. Again, that will be open access. We will have a section in there dedicated to Canada, and we will be able to share that with the Canadian Epilepsy Alliance, and you can disseminate it as well through your networks. We're also going to work on a sort of communications toolkit where we'll do infographics, we'll do leaflets, we'll do social media posts, we'll do presentations that we can use to present either the global results, regional results, or national results at congresses, at conferences, at meetings and events longer term. So we're hoping this will have legs and we will be able to get this out there. And we also committed to your colleagues, Trevor, at the Canadian Epilepsy Alliance, that we would do a meeting specifically with CEA next year, where anyone interested could come, hear the results that were presented, and maybe contribute their thoughts as to whether they feel that's reflective of their lived experience, or whether we need to do a deeper dive in some areas, and to really understand, how the results speak to people and how people are analyzing and interpreting them personally.
Thank you so much, Donna. I know I'm repeating myself, you're a very, very busy individual. So I really appreciate you taking the time to really break down this survey and sharing a little bit about your connection to epilepsy. I'm going to give you the final word here, the final say here. What would you say? Actually, a bonus question that just came to my mind, I apologize, is what else is the IBE working on? I know the survey is a very big focus right now, but what else could we look forward to from hearing from the IBE for whether it be the rest of the year or early next year?
Yeah, so early next year, we kick off with the 50 Million Steps campaign, which runs every year, early January, just after Christmas, up until International Epilepsy Day, which is the second Monday of February every year. I think next year it's the 10th of February. So that early part of the year is a really good opportunity for awareness raising, going back to what we were talking about. The theme this year is for International Epilepsy Day is going to be My Epilepsy Journey. So it will actually speak to the Global Epilepsy Needs Study and what people are telling us is most important to them. And we would encourage people obviously to take part. That leads, of course, into March and Purple Day, which we know is a big day for you guys in Canada too. So that first quarter of the year is a lot of major opportunities for large-scale awareness raising that we hope to be able to support and drive forward as IBE. The other project we've just launched is our Global Epilepsy Leaders Program, and this is around bringing together people with epilepsy who want to play a role as leading advocates in our field. And we are providing them with capacity building, skills training, and also that sense of a network and community where they can build out their skill set and they can have the opportunity to learn more about epilepsy, learn more about IBE, but also pick up skills in areas like advocacy, in areas like research and development, generating evidence, communications. So really important for us to have people coming through who can speak up on behalf of our community at all levels. So that is a new program for IBE that we are conducting. And I think obviously next year as well, we'll have the International Epilepsy Congress coming up. It's going to be in Lisbon, Portugal at the end of August, early September, which is always a big event for us too, supported by regional congresses throughout the year. So things are busy. One thing I will flag actually is we are having regional workshops for young people with epilepsy online over the coming weeks, including one in North America. So if there is anyone listening in Canada who would like to participate there, what we'll actually be doing is sharing some preliminary insights from the 18 to 35 group of the Global Epilepsy Needs Study and starting to think about whether what's emerging is really resonating with those young people and gathering their thoughts as a sort of focus group, I guess, as to how these results could and should be used to really improve quality of life for young people with epilepsy. Maybe Trevor will send you those details and we can put them out across the platform as well for anyone who might be interested.
Perfect. Well, again, I'm repeating myself, but I really appreciate you doing this. Again, you're such a busy person, but I really appreciate all the information. And we will, of course, promote the survey in the link in our bio and in the caption. And the Canadian Epilepsy Alliance, we're going to be going to the Clay Conference actually tomorrow until Sunday. So I personally vouch that I will bring that poster with me and I will put it on our community booth there, and I'll be speaking to every neurologist and talking to everyone at the conference. I vouch for you that I will be doing that this weekend. That will be my homework. But I will obviously promote the survey as much as I can, and I appreciate you breaking down this survey. You've been really, really, really helpful here explaining this. I thank you so much.
Thank you, Trevor. We'll send you a t-shirt with the QR code, but from my side, just to finish with saying that, we really are grateful to CEA for partnering with us on this, for helping us promote and disseminate in Canada. And hopefully, you know, we can reach that 250 mark in terms of responses, and then continue to work together around, you know, how do we actually use these results to make a difference for people with epilepsy in Canada and across the world. So I appreciate this opportunity to come on and talk to you. I know I had said we'd talk for 5 minutes, Trevor, and I've kept you here for
Well, I
over a half an
apologize as
hour,
well.
but it's been
Bonus
great.
questions kept organically coming out of me. You're a really interesting person to speak with. October 31st is the deadline for the survey. So I just want to repeat, October 31st is the deadline. Again, I'm going to promote the link in the bio and through the caption. Thank you, Donna, for your time.
Thank you, Trevor. It's been a pleasure.